I recognize the Attorney General.
Thank you very much, Speaker, for recognizing me to speak on Bill 163, the Safe Access to Abortion Services Act. Speaker, I want to thank the Minister of Status of Women for her eloquent words and speaking about the importance of this bill, and I thank her tireless advocacy every day for women across the province. Speaker, I also want to take this opportunity to welcome Sarah Hobbs-Blythe and Chelsea Barnett, who are with the Planned Parenthood of Toronto and have been a strong advocate for this bill. Thank you very much for both of them for being here today. Speaker, I rise in the House today to continue debate on a bill that would, if passed, send a clear message that our government will always stand up for a woman's right to choose. Days like today, being able to stand up in this legislature and speak on such a vital piece of legislation are part of the reason that I personally got into politics. As a student, as a lawyer, and now as a politician, it has always been my steadfast belief that every woman in Ontario has the right to make decisions about her own health care, and they deserve to do so freely, without fear for their safety, privacy, or dignity, without fear of being judged or publicly shamed because of their choice, without fear of being threatened with violence, harass, or intimidation. No woman should ever have to take such things into account, Speaker, when just trying to access basic healthcare services that are important to her. Speaker, I often spoken about my family's journey to Canada. And one big part of that journey, Speaker, was the desire on my mother's part to come to a society which treats women and men equally. She often says that she knew when we were growing up the country where I was born, that she at home treated her two sons and her daughter equally. But the moment we had three left home, that was not the case. My sister was not treated equally. And she wanted to come to a society where women are protected, are respected, women can do what they want to, and most importantly, as in this instance, women are able to make decisions about their own health care. That choice is between herself and her healthcare provider and nobody else's. And this bill very much goes to the heart of that very important right and protection for women in our society. Speaker, you will hear me speak a lot about women and patients during my remarks today. And this bill is, after all, for them. But before I get too far in the debate, I want to be unequivocal in this House to those watching at home and those here in the galleries. When I mention women and patients throughout the course of this debate, I want to acknowledge the trans and non-binary individuals who may also access abortion services. They too need and deserve the protections we are talking about today. And this bill, written in a way, ensures that those individuals, those who may be trans or non-binary, also receive the safety and protection as outlined in Bill 163. Speaker, the choice to access abortion services is a deeply personal one. Patients have the right to choose to access abortion services with their privacy maintained, free from outside intimidation or interference. And clinic staff and health care professionals who provide abortion services must also be protected. They should not have to fear for their safety or for their safety on their way to or from work, or when they return home at the end of the day. Over the past several months, we have heard reports of heightened security risks and privacy concerns around clinics and facilities that provide abortion services in Ontario. In my hometown of Ottawa, as was mentioned earlier, protests at the Morgentaler Clinic have reportedly escalated, and we have heard similar reports from clinics and facilities right here in Toronto. Speaker, while I strongly support everyone's fundamental right to freedom of expression, our laws must balance that right with the need to protect access to abortion services and to protect the safety, security, health, and privacy of patients and providers. Activities that jeopardize the safety, security, health, and privacy of patients and providers are not acceptable. After I heard the reports from the Morgentaler Clinic in Ottawa, I began to ask how could patients and providers be better protected from these activities under the current law. I think many people, including myself, were under the impression that abortion clinics were already protected by injunction orders. What I learned, however, is that we do not have consistent protections in place across the province. And that came as a speaker, personally, a surprise to me because I thought that protection existed province-wide. In fact, Speaker, most clinics in Ontario are not currently protected by the injunctions that we found in our books here in Ontario. There are also numerous other facilities in Ontario that offer abortion services, including hospitals and pharmacies, where protest activities are not restricted by any injunction. After learning of this, I announced that the government would introduce legislation to protect women, clinic staff, and abortion service providers across the province. And 4 months later, I'm proud to see this happening. Speaker, over the summer months, the Ministry of the Attorney General began looking at other jurisdictions like British Columbia, Quebec, and Newfoundland and Labrador that have already enacted safe access zone laws within their own jurisdictions. All three of these jurisdictions introduced legislation in response to ongoing protests and concerns from clinics regarding the ability of their patients to access abortion services and the safety of their providers. British Columbia's safe access zone legislation was passed in 1995, while Quebec and Newfoundland and Labrador passed theirs more recently in 2016. British Columbia's legislation in particular provided an important starting point in terms of developing this bill, Bill 163, and its courts have upheld the constitutionality of its safe access zone laws in 3 separate constitutional challenges. Speaker, our bill is also responsive to what we heard from stakeholders about how abortion services are currently provided in Ontario and the impact of protest activities on women, staff, and healthcare providers. For example, Bill 163 builds on British Columbia's approach in the following ways. First, British Columbia's legislation establishes automatic access zones around the homes of doctors who provide abortion services only doctors. We propose to establish automatic access zones around the homes of doctors and clinic staff and other regulated health professionals like nurses and pharmacists who provide abortion services. We believe it is important to recognize that abortion services are provided in Ontario in teams, and that no one on that team should be intimidated, physically interfered with, or targeted where they live and the job that they do. Second, Speaker, British Columbia's legislation sets out a 20-meter maximum size for access zones around clinics and facilities. We are proposing maximum access zone sizes of 150 meters instead. This size is comparable to the size of a private interlocutory injunction the Morgentaler Clinic in Toronto obtained in 1989 and would provide greater flexibility to protect particular clinics and facilities as needed. Thirdly, Speaker, British Columbia's legislation requires abortion clinics to apply for safe access zones. We are proposing in Bill 163 to establish automatic safe access zones around abortion clinics in Ontario. We heard that patients and staff at these clinics are particularly vulnerable and identifiable to protesters. Finally, our proposed legislation would allow for safe access zones to be created at locations that prescribe or dispense drugs like mifegamicil, that terminate pregnancies, and at the homes of professionals that prescribe or dispense these type of drugs. This approach recognizes that the healthcare landscape is changing, and that professionals that prescribe or dispense these drugs should also be protected in the areas where they live and work. As you can see, Speaker, the legislation we're proposing would reflect the reality of how abortion services are provided in Ontario. And I'm proud to say that Ontario would set a new standard through Bill 163. If passed, this legislation would make Ontario a leader in protecting access to abortion services and the safety, security, health, and privacy of those providing and accessing these services. Speaker, the laws in other parts of Canada provided a good starting point for the development of this legislation. But we needed to make sure that changes we were considering would work for Ontario. And so we asked a number of Ontario health, legal, and advocacy groups for their input and expertise. To strike the right balance between protecting freedom of expression and the need to protect the safety, security, health, and privacy of women and providers, we needed to hear from a broad group of partners. They included abortion clinics, health organizations, community health centers, pro-choice advocacy groups, and legal associations. But Speaker, we also, in our consultations, approached and spoke with anti-abortion or anti-choice advocacy groups as well. As you can see, Speaker, we did not shy away from hearing different views and perspectives on this very important issue. Some groups advocated for these changes, while other views fell on the other end of the spectrum. We considered all of the ideas carefully. Over the course of the consultations we conducted in August, these groups provided information about the provision of abortion services in Ontario today and ideas about what this could look like in the future. We also heard about anti-abortion protest activity and its impact on women, staff, and healthcare providers. I would like to thank each of these groups for sharing their time and expertise with us through our policy deliberation. Their input, Speaker, helped us to develop legislation that I think will make a significant difference in protecting women in our province. While I know that some may not agree with these changes, I strongly believe that we have struck the right balance between protecting the safety, security, health, and privacy of people accessing or providing abortion services with the right to freedom of expression. However, Speaker, just because I believe we have struck the right balance and that we have consulted extensively does not mean that we should not consult or receive the input of stakeholders and experts through the committee process at the Legislature. I would like to say that I have heard and understand the frustration from some about our government's decision to pursue debate and committee on this bill. And I say that because I too would have loved to have seen this bill pass immediately. It was still an incredibly difficult decision. But at the end of the day, Speaker, I feel strongly that this bill is too important to cut corners. I believe we have clearly demonstrated our commitment to moving this bill quickly by drafting and introducing it in less than 5 months. However, stakeholders and experts should be given the opportunity to review and provide feedback on this important piece of legislation so that if changes are needed, we hear that before the bill is passed, not after. I am very pleased, Speaker, that we have come to an all-party agreement, as you're aware, to move this bill through debate and committee in the next couple of weeks. This strikes the right balance of moving quickly while taking the time to ensure that we have effectively reached our goal of protecting women and healthcare providers. Speaker, I was thrilled to know that other two political parties support this approach in this legislation. That was music to my ears. And we made sure that right away we approached the opposition parties with a proposal that ensures that we have an opportunity to hear from stakeholders at the committee and also have some important debate while passing this bill in a time frame. Because, Speaker, that's the timeline that we've been pursuing in terms of making sure that we've been able to get this work done in a very short period of time. And if we can get this legislation passed in even shorter time period, that is good news for women in our province. Speaker, the changes we're proposing today would have a far-reaching impact. They will signal to everyone in our province the importance of a woman's right to choose and our government's support for that right. Last week, I visited 2 centers that provide vital health services to women in both Toronto and in Ottawa. And I heard from countless women who were supportive of this legislation, as it would provide a consistent framework for protecting those who exercise the right to choose across our province. I also like to share with you the words of Catherine McNabb, for instance, who is the Executive Director of Planned Parenthood, Ottawa. And I quote, she said, "No one should be intimidated or publicly shamed for seeking a safe and legal health service. This legislation will change the landscape for people seeking abortions in Ontario by letting them focus on their health instead of their safety. We commend the Attorney General's swift action for making it a priority in Ontario." End of quote. That is great to hear because, Speaker, it is incredibly important that this proposed legislation have the support of Planned Parenthood Ottawa among many other women's health centers and facilities across the province. They do critical work to help women make informed choices about their health care. They, in fact, Speaker, are in the front lines, and they have experienced the fear, the threat, the intimidation in the past and as we speak. Speaker, I also recently had the pleasure of visiting Planned Parenthood Ottawa's office, where I heard firsthand the impact that this legislation would have on the lives of the women who access abortion services and the healthcare professionals who provide them. What I heard from the staff affirmed even further to me that these changes are absolutely needed. They told me about the strain that protest, intimidation, and harassment near clinics and facilities that provide abortion services can have on patients and on providers. That could include providing unwanted advice to people waiting in the lobby of an abortion clinic or facility, holding up signs outside, or taking part in other activities in nearby clinics and facilities that provide abortion services that are intended to interfere with people accessing or providing abortion services. Speaker, as I said earlier, while I strongly support people's freedom of expression, activities that jeopardize the safety, security, health, and privacy of patients and providers are unacceptable. They violate a woman's sense of privacy and can intimidate them, cause them physical or psychological harm, or interfere with the access to abortion services. These changes would go a long way to making our communities feel safer for everyone. It would allow people to focus on their health first, rather than on their safety or security when making important healthcare decisions. Speaker, this bill and the timing of it could not be more important. As I mentioned, the current protections we have in place simply do not cut it. Women across Ontario deserve the assurance that should they choose to access abortion services, they will be able to do so privately, safely, and securely. I can't imagine having to deal with that fear, particularly at such a stressful time. The bill we are debating today would limit anti-abortion protest activities in designated areas. Our intention is to protect access to abortion services by putting a distance between the protesters and people seeking to access and provide these important services. In these designated areas, anti-abortion protest activities and interference and harassment of people accessing or providing abortion services would be prohibited. To start, there are 8 abortion clinics in Ontario that would be automatically protected. They would have safe access zones of 50 meters, but the size of these access zones could be decreased or increased up to 150 meters by regulation. The proposed safe access zones would include the property on which the clinic is located and start at the boundary of that property. Speaker, I want to be clear that we are not denying people's right to protest. They are free to express themselves and engage in anti-abortion protests, but not in those designated areas around clinics, facilities, and homes where doing so may prevent a woman from making a decision about her own health care out of fear for her safety, security, health, or privacy, and not where doing so intimidates clinic staff or healthcare professionals from coming in to work in the morning or going home at the end of the day. The law would not prohibit anti-abortion protest activities that take place outside the safe access zones. To get a better idea of the size, Speaker, just think of an Olympic-sized swimming pool, which is 50 meters long. I often get asked this question, what is 50 meters? And that's roughly the space one is talking about. Now, Speaker, we know that there are staff and patients that provide or seek abortion services outside of the 8 abortion clinics in Ontario as well. Abortion services are also provided at other facilities, such as hospitals, pharmacies, and health centers. To ensure these facilities are adequately protected, we are proposing to make available an application that would allow these facilities to apply for safe access zones of up to 150 meters. This means that locations where mifenycil is prescribed or dispensed would be eligible to apply for safe access zones, which is now available at no cost to women who need it, thanks to the work that the Minister for Status of Women and our government has done along with the Minister of Health. Safe access zone protections would also be extended automatically to the homes of all clinic staff and health professionals that provide abortion services. Doctors, nurses, clinic staff, and other regulated health professionals who provide or assist in providing abortion services would automatically receive safe access zones of 150 meters around their homes and could not be subjected to intimidation, physical interference, or other targeted anti-abortion activity where they live. Speaker, we know that many health professionals work at multiple locations. Health professionals who work at several offices would be able to apply for safe access zones in each of these locations. Finally, Mr. Speaker, the proposed legislation includes a general anti-harassment provision to protect providers of these services wherever they are from harassing conduct directed at them. This means that providers should not have to fear for their safety while they're out in public because of the work they do. Under the proposed legislation, they would be protected from harassing conduct, whether they are at home, at work, or picking their kids up from school. Speaker, it is my steadfast belief that every woman in Ontario has the right to make decisions about her own health care, and that she deserves to do so freely, without fear for her safety, security, health, or privacy, without fear of being threatened with violence, harassment, or intimidation. Speaker, no woman should ever have to take such things into account when accessing healthcare services. And neither should clinic staff and healthcare professionals who are just trying to get to work in the morning like the rest of us do in our lives. The legislation, Speaker, before you today is about protecting women's safety, security, privacy, and health. It's about protecting and defending their right to choose. Speaker, it is incumbent on us to to provide for these protections in law. It is unfortunate that we have not had these consistent protections in our system up to now. Speaker, it's also important to me as the Attorney General to bring forward a law that is constitutionally sound. A bill like this, Speaker, which is speaking of competing rights, a woman's right to access healthcare services and somebody else's right to freely express themselves. One can understand, Speaker, the delicate balance that has to be accomplished in order to make sure that you've got the right balance between these rights. And that is why, Speaker, the work we have done in a fairly short period of time is very important, both in terms of understanding legislation from other provinces, looking at the jurisprudence that exists, the case law that has developed, especially through the challenge that the British Columbia legislation went through. Of course, looking at other pronouncements by Supreme Court in matters of rights around access to healthcare services, freedom of expression. But also, Speaker, in that deliberation is important that, from my perspective, that we have that thorough analysis, that we have that thorough work in terms of the work that is being done through consultations, but through the legislative process as well. Because, Speaker, through the committee process, we expect to hear from advocacy groups as to the challenges they feel, in terms of stories of individuals who would benefit from such legislation like that, so that we better understand why it is important that we protect women's access to abortion services, why it is important that we create that balance between somebody's right to express themselves or protest, but to do so from an appropriate distance, so that there is a safe access available for a woman to be able to access these services, and the providers to be able to get to work to provide these important services. I know, Speaker, in this House, a lot get framed, and that's the world we live in, around what may be the appropriate political game may be. And I just want to be very clear from my perspective, Speaker, that this is about protecting women's health. This is about protecting women's right to choose. And I am confident that no member of this House, Speaker, on behalf of all the people we serve and the women we serve, would jeopardize that by engaging in any political maneuvering, because I think that's not our purpose here to serve. We all want to make sure that everybody's have safe access to healthcare services, and in this case, women who need to have those services. So I look forward to continue working with Speaker, with all members of this House in passage of this bill. I want to thank the very brave providers, advocates on behalf of women who do some incredible work in sometimes very difficult circumstances. They are mostly women who do this work. They're extremely brave to speak out, to provide these important services at times where their workplaces, access to their workplaces is very, very difficult, that majority of us never face. The majority of us don't have to go through throngs of protests or imagery that could be extremely disturbing to the work that you do. These are very strong women and men, and I want to thank them for the work they do. I want to thank them, Speaker, for their guidance and advice as we, through the summer months, in a very short period of time, asked for their thoughts and their suggestions as we did the policy deliberation and develop Bill 163. And I look forward to continue working with them. I look forward to keep working with all the other members of this legislature so that we can pass this bill quickly and work on the regulations that accompany this bill so that we can have consistent protections for all women accessing reproductive health and abortion services in our province. Thank you very much, Speaker.